Welcome back to the Blood Clot Briefing. In this episode, Dr. Amman Sharma and Louise Thompson explore a life-threatening connection that too many people might overlook, the link between cancer and blood clots. Discover why clots are the second leading cause of death in cancer patients, the warning signs to watch for, and what you can do to stay one step ahead. Stay informed, stay safe.
Hello everyone, welcome back to Thrombowatch. I'm Dr. Amman Sharma, my co-founder Louise Thompson, and today we'll be talking about cancer and blood clots.
Thanks, Dr. Sharma. So as part of the work that we've been doing here, I learned that if you have cancer, the second greatest thing that is likely to end your life after cancer is a blood clot.
Yep.
That coincides or runs alongside the cancer. I had no idea about that.
Okay.
Can you explain a little bit about how that happens?
Absolutely. So people, unfortunately, who get cancer, so cancer is a very sort of pro-inflammatory condition. Okay, so you've got growth in the body which is secreting continuously chemicals and hormones and few things, biochemical markers which are constantly causing a bit of rush in the body. Rush in the sense they're causing excessively inflammatory cells. These inflammatory cells are going in various organs, causing organ damage. The blood vessels itself is getting inflamed. So now you're in a state where you're very hypercoagulable. Your blood has become thick and
Yep.
viscous, and you've got inflammatory conditions all over your body, thereby increasing the risk of you to have clots. That's why cancer and clots go pretty much hand in hand.
I had no idea, and I don't think many people do. Is there a particular type of cancer that is more likely to lead to a clot?
Absolutely. The scientific research has shown that few cancers are more prone to have blood clots. When we talk about pancreatic cancers or the bone cancers, even lung cancers, few data suggest even breast cancer. So these are the cancers which have more higher risks of one to have blood clots. But see, you have to understand a very basic concept here. Person who has got cancer does not have a great appetite, right? They don't eat well, they don't drink well because they have less energy. They won't be mobilizing as much around as a normal person would be. So now you've got a vicious cycle where you're dehydrated, where you are immobilized. You've got a chronic inflammatory response in your body, and on top of it, even the medications, the chemotherapy drugs that we give, they, how would they work? They kill the cancer cells, but they would also be killing few of your body cells, isn't it? So eventually all of this leads into a state where, yes, again, the blood clot can come out of nowhere, can pop out of nowhere.
So previously we've talked about how your blood clot basically has to take you as it finds you. So you might already have heart disease, for example, when you get cancer. So you've got cancer, but you already had high blood pressure. You previously had a stroke. You might also have obesity. You might also have genetic risk factors that we previously talked about. All of those could make the likelihood worse.
Of course, see, the precipitating factors have to be there in some way or the other, isn't it? But when someone has got a cancer, as I said, you are entering a stage where there's a constant warfare going inside your own body. You've got cells from your own body which have gone rogue, and they've replicated and multiplied in a way that they're causing symptoms, whether it's pain, whether it's the organ not functioning well, whether it's blood vessels getting blocked in terms of compression. There's so many things that can happen, essentially, isn't it? They can go and infiltrate the other organs, which we call as metastasis. So this is all happening. And then again, as I said, if you've got further risk factors, what will happen? A clot will form somewhere, either in your legs, maybe in your lungs, and eventually cause more, more symptoms and more sort of catastrophic effects on the person. So, as I said, cancer is another risk factor, you may say, along on top of the other risk factors, which are always a risk. Smoking is a risk, as we said, less physical mobility is a risk. So cancer is a sum of all phase where you see all of this coming into one picture and causing. And as you rightly pointed out, few cancers have the higher tendency and the potential to bring more blood clots in, whereas the few, like the skin cancers and stuff, are not that severe and they can potentially spare you. But unfortunately, in the longer run, cancer, blood clots go hand in hand.
Okay, thank you. So when you are being looked after in hospital, when you're being treated for cancer, the medics are aware of considering your own history and the likelihood of the drugs interacting, the cancer interacting to give you blood clot, how is blood clot management undertaken?
Absolutely, very good question. So, I would like to assure all of the audiences watching this that everyone who comes to the hospital have something we call as a VTE assessment, veno thromboembolism, as we call it, isn't it? So, you do have an assessment when you come into the hospital within the first 24 hours. So, there are a couple of things that we do consider. What's your age, whether you're going to be immobilized, whether you have got multiple comorbidities, whether you recently had a surgery, whether you've got cancers. There's a big list to it. Okay, so anyone who comes in and we feel, oh, they're on the higher risk. Of course, person who has oncological problems, the cancers are on the higher risk. So we would prescribe them medications. Usually we give them enoxaparin. It's an injection that goes into the tummy. People who can't have enoxaparin, like for instance, some blood-borne cancers, as you rightly said, if the platelets are very low, the blood cells are very low, then we might not give them the blood thinning medication. They might get the stockings, that the
Yeah.
uncomfortable stockings that we were talking about earlier on. Whereas few people who are already on anticoagulation would be continued on their anticoagulation of choice. But regardless, yes, people who come to hospital are assessed and they are given appropriate anticoagulation or preventive measures so the clot does not happen. And even if it has happened in the past, we do try to keep a close eye on the symptoms of the patient. Again, people who have blood clots, the most common thing where they have is your legs, isn't it? So again, swelling of your legs, redness of your legs, they're becoming swollen compared to the other leg, nagging pain. These are the symptoms that you need to be watchful for, and we as clinicians do try to see them in our day-to-day ward rounds.
Okay. And of course, the cough that I've now learned, if a DVT has broken off and gone to the lung, the cough is something that I would always be.
Yeah.
But you could have a cough for other reasons as well.
See, you have to be a bit watchful. We always keep saying this, be watchful, but if you've got a cough and you've got a chest pain, at times you're throwing up some expectoration which might be pinkish or reddish in color. These are obviously the red flags from the patient's end. For us as clinicians, yes, we do keep a history of the heart rate, the blood pressures, the respiratory rate, the oxygen requirement, and if any of these things are going up and down, yeah, we do consider and suspect pulmonary embolism in them.
There was very recently a very sad story of a young boxer, a really promising boxer in the UK, a young lady called Georgia, who unfortunately developed cancer. And also, she described the fact that she had pulmonary embolism and she very sadly passed away. It brings it home to you that even if you're really young, if you have cancer, or we've heard of other people who've had deep vein thrombosis or pulmonary embolism for other reasons as well, it can affect you if you're really young, which is quite a scary thought. Is there anything that you would say other than, of course, that was a really sad story and tragic?
Yeah,
Is there anything to add?
unfortunately, we've all had seen people in our lives, friends, families who've passed away with cancer. And like my grandfather had throat cancer and he passed away at the age of 56 because there was not much to be done. And when his cancer was caught, it was already spread into the lungs and stuff. So we couldn't do much on him and he sadly passed away. But yeah, cancer doesn't spare people if you're young, you're old, isn't it? If you're in bustling 20s or you're in your 60s or in your 80s, it can come at any point of time. Yes, younger people get it less frequently compared to the elder people or people who are in their advanced post 50s, 60s. But regardless, the symptoms, the red flags remain the same. If you think you're losing weight without any proportion to what you're eating, or you're not trying to lose your weight, not having any sort of supplements or anything, which we'll talk later, but if you're losing weight, no reasons, no answers, your appetite's gone off, it's up and down the hill, you're having night sweats, you're sleeping, you're drenching in sweat when you're getting up, right? You're just not feeling the right amount of energy, feeling drained all the time. All of these symptoms, along with, you might, you have cough which is having blood in it, you have a poo which has a blood in it, you might have a wee which has some blood in it. All of these symptoms essentially are the triggering factors for you to think, oh, why is this happening? Is there something wrong? And if you go to a physician, to a clinician, they would make note of it and you would be referred. In the UK, we are blessed with, there's a system called 2 week wait. We're changing it now, but essentially it means that you would be prioritized and triaged in a way that if you have any suspicion of cancer, and we feel there's a suspicion of cancer, you would be quickly triggered on a pathway where you would be assessed quickly. If you need scans, scopes, whatever, that would be done fairly quickly. What I would also request our viewers, especially our elderly people, many of us do have received letters about smear examinations, about fit tests, about urine tests, and we feel, oh, let it be, let's not go. These are very crucial and important tests because these can essentially get hold of the cancers, catch the cancers at a very early stage. The earlier we catch it, the good prognosis we have. We can give you medications, we can give you radiotherapy, we can give you chemotherapy. That's how we can save lives essentially. But yeah, cancers, blood clots go hand in hand. We should be a bit vigilant, a bit watchful. And for all you people out there, if someone in your family has got cancer and they have these sort of symptoms, just think whether they have a blood clot, and that might save their life.
Thank you.